on catheters and cathing, the way that I do it using my Mytrofinoff, and the catheters that I like to use versus the catheters that I'm not so fond of. The catheters that I do like to use are the Hollister catheters here, which are 14 French. I always use 14 French if I can, as diameter. I like the Hollisters because for some reason I am able to use these without lubrication. So they do not come lubricated, and yet they still go in nicely. And so I'll go ahead and just lift up my shirt a little bit so you can see my stoma. My stoma is in my belly button, and that is what the Mytrofinoff surgery is for. It is for quadriplegics to be able to catheterize from their abdomen instead of having to take off all your clothes and do it the other way. So I luckily had this surgery done in 2005. And I've been very happy with it, even though I have a lot of abdominal pain, and it is uncomfortable for me to cath. However, you know, we have to do what we have to do. So these are the Hollisters, and I want to show you the catheters that I don't quite like using are the Cure catheters, and they're also 14 French, and I get the male length, but I ask for the male length or the longest catheters and 14 French. And the Cure catheters come with that little package of saline water. It says purified water. And these Cure catheters that are 14 French actually take me a little more time because I need to then open catheter, tear open this purified water and get the catheter lubricated while putting it in. So I like the Hollisters or barred catheters the best, and I'm going to show you how I do this as an example to show that it's not an easy thing all the time. It can be quite the art of just being patient with your bladder, because you sometimes don't get the output you need. And I also want to say that every morning I need to irrigate my bladder with sterile water, which is just sterile water that I get from my primary care physician that orders it, and I pick it up from the pharmacy. Some pharmacies will not order it and supply it, and some pharmacies will, so I've just called around to local pharmacies. And I'll show you how I irrigate the bladder, and I've put some sterile water in this cup here with my 60 cc syringe, and this is how I catheterize. So there's my belly button, and there's a stoma at the top. I'm just going to insert, and I insert the catheter until I get an output. Should be now. I drain my bladder until it's done. The catheter empties into a Gatorade bottle in my lap. And I will fill this syringe with 30 cc's of sterile water. I usually do about 30 or 35 cc's because I never know if my bladder still has a little bit of urine in it, and if it does, I don't want to overfill my bladder with this water. So I'm nice and cautious. I use 30 cc's every morning. I insert the 30 cc's and pull it back out Now if it gets stuck, which right now I can't pull it out and it's resisting, I pull out the catheter a little bit and then I get a little bit more return. And if it still won't, then I just simply stop what I'm doing and let it drain on its own. I'm not going to try it again since I wasn't able to pull back out that 60 cc's or that 30 cc's. I'm just going to let my bladder be because I don't know why it is finicky or what is wrong with that. However, I still was able to clean out my bladder. So then I'm going to take some toilet paper or sterile wipes if you have them. Which I typically do. I do have baby wipes at every corner. And that is the Mytrofinoff and stoma procedure that I do every morning and 6 times a day. And then I also wanted to show you, those are the 2 straight catheters that I use. But the quickest way for me to catheterize when I'm out are to use these Coloplast speedy catheters. These Coloplast speedy catheters come in a nice compact kit. I open them with my teeth, however, to break the seal and pull off the cap. Comes with a bag attached. And these we can get free through Medicare. If you have frequent UTIs, just ask your doctor to contact your catheter distributing company, which for me right now is ABC Medical, and the doctor that they go to is my primary care physician, or actually the doctor that they confirmed this with was my urologist at UCDavis. So my urologist told my insurance company, the catheter distributing company, that I get frequent urinary tract infections and therefore need an easy cath, speedy cath with a bag attached. So Medicare is paying for these for free, and I've got I think $900 for 30 days, or for 3 months, $900 for 3 months. These are nice and easy. They are the male length as well. They have a bag attached, and they are lubricated, nice and easy to use. Let me scoot back. Now that I'm sitting up so straight, it's harder to figure out my cathing. However, that is how these work. And then I'm patient, and I let the bag fill about halfway, and then I am done. I can empty it into the toilet, even put this handy and bag on if I'm not somewhere that it's easy to toss out, and therefore can throw it away later. Speedy caths are nice. They're from Coloplast. So those are the 3 different types of catheters that I get, and also throughout the years I have had to change the company that I used to get my catheters. That threw me off, but there's always a way to do it, and you just have to persevere. So that is how I catheterize now. Now I'll show you how I keep my bladder healthy.